Hello, leaders of the world. Welcome to Spread Love in Organizations, a podcast for purpose-driven healthcare leaders striving to make life better around the world by leading their teams with genuine care, servant leadership, and love. I'm Naji, your host, having the pleasure to be joined by Maheen Junaid, General Counsel, Chief Human Resource Officer, and Chief Compliance Officer for Kaba Fusion, a home infusion pharmacy provider. Maheen holds a JD LLB from the University of British Columbia and an MBA from MIT, where we met. In her executive role at Kaba Fusion, she is committed to fostering a positive work environment that celebrates diversity and inclusion. She also loves working for an organization that promotes a culture of prioritizing quality and compassionate patient care while being innovative and entrepreneurial. Maheen has also worked in the nonprofit sector and is passionate about empowering and enabling marginalized people through advocacy and support. She was born in Pakistan and was raised in England and Canada. Maheen currently resides in Massachusetts with her family. It is such a pleasure to have you with me today, Maheen.
Thank you, Naji. It's a pleasure to be here.
Since we're friends, as a disclaimer, I had the privilege to hear your incredible journey, now leading Kaba Fusion through different lenses. Can you share with our listeners a little bit more about who you are and your inspiring story?
Sure. So that's always an interesting question. Who am I, right? And I'm definitely all the roles that I play within my life to different people. So I'm a mother, I'm a daughter, I'm a friend, I'm a wife. And then I'm also all the, professional titles or accreditations that I have, but I would like to think that I'm definitely more than the sum of that. So I think that if I had to pick one word that I identify most with, I would say that I'm an immigrant. And so I was born in Pakistan. And then when I was 4, we moved to England. When I was 8, we moved to Canada. When I was 25, I moved to the States. And so a lot of my ideology, who I am, who I aspire to be, how I want people to be treated is based on that notion of being an immigrant or identifying as an immigrant. So I was thinking about it, just even in terms of like the generations of my family. My grandmother, she was born she was raised in India. My mom, she was raised in Pakistan. Myself, I was raised in Canada. My daughter, she's being raised in the States. So even within the 4 generations of our family, we were all raised in 4 different places, but each of those countries hold a place in my heart. But when somebody asks, where's home or where do you come from? That's a very difficult question for me to answer. And over time, I realized that home is not a physical place. It's a culture or an environment in which there's inclusivity, acceptance, there's love, and there's opportunities for growth. And so then that's kind of how I identify home as. And throughout my professional career, I realized that those are environments that you can create within an organization as well for people to feel like they belong. So that's kind of a little bit about my personal journey.
I love it. And I really enjoyed your definition of home. I somehow sometimes feel the same about where, I don't know where home is. So I love how you framed it. What brought you to healthcare? Like you have a very diverse also background in the studies you've done. So what brought you to healthcare and Kaba Fusion?
It was a very interesting and random journey to get into healthcare, and I'm really glad I did. So kind of just to backtrack, when I went to school in Canada, I went to undergrad in Canada. And then when I was in undergrad, my parents, asked me, what is it that you want to do after undergrad? Like, what profession do you want to go into? And again, being an immigrant in a lot of these immigrant countries, there's this holy trinity of professions: lawyer, doctor, engineer. And you have to be one and you have to marry the other. And so my parents, they said, we're not going to be like the typical Pakistani parents. We're not going to tell you what to do. This is your life. This is your future. You get to decide. And I said, that's really interesting because that's usually hasn't been the case, but thank you. And they said, no, this is your future. We want you to choose. You can either choose to be a doctor or you can choose to be a lawyer. And so I ended up having those two choices. I ended up choosing the profession of law because I felt at that time, while every profession has a lot to work on in terms of diversity and representation, I felt that in the field of medicine, there was still more representation at that time than there was in the field of law. This is early 2000s. So I decided to go into law to kind of diversify the field of law and have more representation, but also be able to advocate on behalf of those who are underrepresented. And so that's kind of how I began my legal journey. And initially, I was working for a general law firm that practiced a lot of immigration law. So I did a lot of immigration law. And that was a very interesting experience because I would do a lot of appeals and denials of visa, and I would have to go to immigration detention centers. And I would see these individuals that, I mean, we can argue back and forth that, what led them to be in that detention center and why they were there and that whether they did something illegal. But when I would look at them, I would see my parents or other immigrants that just wanted to come here for better opportunities. So that was a very interesting experience for me. So I felt like, okay, I'm going to stay in, kind of like immigration law, kind of nonprofit sector. I moved to the States when I got married. I took my bar here as well in Massachusetts, and I started working in the nonprofit sector. So I was working for Muslim American Society, where I was providing advocacy and trainings for the Muslim community, but also other communities within the Boston, Roxbury area. Through that work, I was able to partner with ACLU, Massachusetts Commission Against Discrimination. So a lot of organizations that really kind of were advocating for, where I was advocating and training underrepresented or marginalized communities or individuals. And then in 2010, I was approached, Kappa Fusion was just starting, and our CEO approached me and said, hey, do you want to do some legal consulting for us? And it was interesting because up till now, I had done, kind of nothing in healthcare, but it was time for a challenge. And I said, I definitely want to challenge myself and see what I can do in a new, area like corporate law. And what I loved about it was that Kava Fusion, even though it's a for-profit, we're very, very focused on patient care. Just a side note, our CEO's philosophy, everything that we approach in terms of our day-to-day interactions, he always has us analyze three things. One, is it legal? Two, is it ethical? And three, is it profitable? If the answer to the first two are no, we don't even get to the third part. Yet we are very profitable and company, thanks God. So anyway, that's kind of how I got into healthcare. It was an opportunity that came up, and I don't say no to opportunities. And so it was an opportunity that came up, and it was interesting because I was approached to do legal, but at that time the company was just starting out. So they said, hey, can you also handle the HR for us? And I said, yeah, no problem. You have 4 employees. I could do the HR, I'll take it on. And again, that was an opportunity and a challenge, and I wanted to take that on. And then within a span of, a year, we went from 4 employees to 100 employees, and we just kept growing, and we're over 1,400 employees right now.
Wow.
So that's kind of how I fell into the field of both legal and HR within the healthcare industry, and I love it.
So that was my next question, because you're leading HR, you're leading legal, also compliance, like so many different acts, different things you're doing within the company, like building culture, but also making sure the risks and external risks are also well managed. And we both know how important this is in the healthcare world. So how do you do this? How do you combine all this and manage to run it for the company?
Yeah, well, luckily there's a lot of synergy between, HR, legal, compliance. And so having insight into all 3 areas actually makes me better in all areas. And then overseeing the staff that I have in all of those three areas, I'm also able to train them to think beyond, if it's somebody in my HR department, I always want them to think from a legal perspective as well. The actions are HR actions, what legal repercussions they can have. Likewise with legal, sometimes, lawyers can be very black and white, and I'm teaching them, hey, yes, we have to look out for the company and we have to make sure we're doing what is right, but at the same time, we can do it in a way that is empathetic and in tune with our employees' needs as well, and our what they're facing. So there's a lot of synergy between the three areas, and compliance and legal as well. And so I'm able to capitalize on all of them and then learn them. And I enjoy it because every day is different. I come in and I'm very excited just to say, what are the things that I'm going to encounter today?
So I would go to this idea that you just shared now about, being empathetic. And I know you really love working on diversity, making sure everyone is included. And you obviously lead with this type of culture in your organization. And you also mentioned the legal aspect, right? So I'd love to know what is the culture that you're trying to build within the company, and how do you lead and make sure people see this?
So it's definitely something that is collaborative. It's not something that I can decide to build on my own. It's something that everybody has to, from the top down, we have to have consensus that this is the type of culture that we want. But what I am really advocating for is a culture of empathy, because if we and that starts from the very beginning. So it's definitely in terms of like our leadership, kind of downstream showing a culture of empathy, but also in our hiring process. So when we interview people, we're interviewing for people that have the ability to be empathetic towards our patients, towards their coworkers. When we train people, we need to train for empathy. When we have managers, we need to performance review for empathy. So it's a continuous process, but it's also in our day-to-day kind of interactions. And one of the things that I always tell, for example, our HR staff, sometimes we have employees who are upset with us, and they may be taking out their frustration on us, or they may appear to be rude. But I always tell my HR staff, and this is not easy, but don't take it personally, because usually it has to do more with what the individual is going through in that moment than how they feel about you. And so if we can do things in an empathetic and respectful way, that's the better way to do it, even when it comes to terminations. So those are the realities of corporate world, or just the employee-employer relationship. Sometimes you have to discipline people, sometimes you have to terminate people, but as long as we do it in a respectful and empathetic way, even if not everybody appreciates it and they may still be upset with you, at least that you have a baseline of doing something the right way.
So true. You have led teams through really different stages in the company. You said you started with 4 employees, now you're 1,400.
Yeah.
And I know you also went through growth, you went through M&As, kind of mixing cultures and all those. And you also led your teams through COVID, which was definitely very impactful for you, for your business, and also your employees going to see patients, high vulnerable patients. What are your key learning, if you can summarize those from a leadership perspective, leading through those different times?
Yeah, I think you summed it really well. Within the last 10 years of Kaba Fusion, we've gone through accelerated growth, pandemic, different situations. So a couple of lessons that I would say that are really valuable for me in terms of, again, we've grown through a lot of acquisitions of other pharmacies throughout the states. And so we have pharmacies and nursing agencies throughout the states at different locations. And as we acquire them, again, going back to like my immigration roots, we can have like a kind of a melting pot ideology or a mosaic ideology. And growing up in Canada, that mosaic ideology was really kind of encouraged, in which you can be Canadian and you can be Pakistani at the same time, and you can be proud of both, and you can be patriotic towards both. And so when we acquire companies, I think one of the things that we have to do is we have to approach that process with humility and not go in and think that we know best, and be really open to best practices. And so there's there's an overarching Kaba Fusion culture of like respect and patient care and work ethic that we want every one of our branches to have. But at the same time, we encourage that local culture as well, and those local best practices that various branches have. And that's really something that has kind of really helped us grow as an organization and really kind of have that assimilative culture between the various branches. So that's one kind of lesson I've learned. And then the other is like going through the pandemic, right? Again, it goes back to like we're a healthcare company, we're patient facing. We did not get to close down. We had to have our employees coming in every single day. And so, especially at the beginning of pandemic, there were so many unknown variables and so much uncertainty, and everything was changing every day. And we're a highly regulated company, so we have to follow not only like federal and state laws, but we have to follow accreditation requirements. We have to follow regulatory requirements, pharmacy board requirements, nursing board requirements. And, kind of everybody had a say or an opinion in how, COVID should be handled in terms of testing, masking, and everything. And so, again, it goes back to humility. Be humble about, hey, with your employees, and say, hey, this is something that we're learning along the way, and we're going to make mistakes, but our goal is to protect you and our patients and ensure that, so many of our patients are so immunocompromised, and just to make sure that they're getting, and especially in these times of uncertainty, they're getting the treatment that they need while still protecting our patients and their families. And so it was, again, this lesson that was like, yes, I never even expected something like the pandemic. And, when you're in HR, it was something that was just kind of completely new to us. But we went in with, we're going to do the best we can, and then we're going to learn along the way, and we're going to be adaptive. And so I think being adaptive and understanding that no matter how many years you're in the business, how tenured you are in your position, there's always going to be opportunities for you to learn and get better.
And it goes to what you shared about humility. I think you are a humble leader, and leading through those times of challenges, this definitely helps. And you talked several times about compassionate patient care. And I know it like this is how you see things, but this is also how the company define it. So I'm intrigued to know, how do you define it, but also how do you ensure that everyone in the organization believes in it and exhibit it on a daily basis?
Yeah, definitely. And I think part of it goes back to empathy, right? Hiring people that are empathetic. So it goes back to the hiring process. It goes back to the training process, where we have expectations from all our employees that they're going to be empathetic and be able to put our patients' need at the forefront. And so even when we do certain trainings that may seem unrelated, or that may not be patient facing directly, like for example HIPAA, the way that I approach it is, it's not that, hey, we have to be careful about this information, because if we're not, the government is going to penalize us. That's there for sure. And then there's reputational damage and all of that. But also, just, would you want your personal health information or your child's or your mother's personal health information compromised in any way? And if that's something that you don't want to happen, why would we want it to happen for our patients? And so really putting ourselves in the patient's position and their family's position, understanding what are some of the obstacles that they're facing. And it really comes from the top down. Our CEO has set an amazing culture of just kind of prioritizing patient care. He always says, as long as I'm not losing any money, even if I don't make a dime, I'm going to treat a patient. And at times we've actually lost money, but he felt that was the right thing to do, was to treat the patient. And so really prioritizing patient care. We have amazing clinicians. We have intake, everybody is we want to make sure that we prioritize the patient first. And sometimes, again, that's not always easy. Sometimes patients are going through their own obstacles and challenges, and they sometimes want to take it out on our nurses, or they want to take it out on our staff, intake or anything as well. And then just really kind of going in with the notion of like, these people are going through a very hard time. Let's not take it personally. It's not about you. It doesn't excuse poor behavior, and we always have to protect our employees as well. But really kind of saying, what can we do for the patient? And so I really feel fortunate to be in a company where I see that every single day.
And this is such a powerful question. What can we do for the patients? And I think, having this North Star definitely helps out in decision making. And you're definitely one company that we can learn from. I will give you one word now, Maheen, and I would love your reaction to it.
Okay, sounds fun.
So the first word is leadership.
Leadership. Partnership. Leadership requires partnerships with your peers, with your reports, with your leaders, to reach a common vision and common goals.
What about equity?
Equity, that's a good one. I would say ideal. That's the ideal, right? We want to be equitable. Sometimes things cannot be equal, but the ideal state is to be equitable. So that's the ideal that we want to reach in our interactions with other people.
Diversity and inclusion.
Diversity and inclusion. Default. That should be the default focus of any organization, and it should happen. Ideally, it should happen organically. One thing I would say, we always really focus on the diversity part, which is really, really important. But the inclusivity part, I would say, is almost more important, because you can have a very diverse organization, but if you don't have the mechanisms and the culture for everybody to feel included, then that's not, that's not beneficial. That's not enough, right? So the inclusivity portion is just as, if not more important than the diversity portion.
And you're passionate about this subject,
Yeah.
obviously. Can you give one or two examples that you do in your company to ensure that inclusion is here, especially, as you said, you expanded so much?
Yeah.
I'd love if you have some practical examples.
So I think it starts again from the very beginning of an employee's experience with you. So we have this program, it's called the virtual water cooler. And because we have various branches, we don't have, our employees are from like all different locations. And so during the first month of their tenure with Kaba Fusion, they join a chat group, and it's called the virtual water cooler, where various members of HR kind of make them feel welcome. They can ask any questions, but then they can also interact with each other and go through that first month experience together with other employees within various organizations, within various branches together, to really create that sense of like allyship. That's my tribe. Like, we started at Kaba together. No question is a silly question. And so it really creates a sense of like community within a greater community. So, just having various initiatives like that. And we have, one of our employees just dedicated employee relations. And so one of the things that we've started to do is that various HR initiatives, we want to have community. So we don't want it to be just HR enforcing it. We want people to feel like they're stakeholders in it. So we have a diversity community, we have events community. And this is all relatively new, because as we grow, we're scaling our initiatives and our programs with that growth. So there's definitely some learning curves, but it's through a lot of those type of initiatives to make people feel included.
Thanks for sharing this. definitely building the sense of belonging as you're, talking about the community you're trying to build throughout the different employees you're hiring. The last word is spread love in organizations.
It's really important that we do that. And one of the things is love, kindness, all these things, all these aspects that people treat as like soft things, they don't, it's not, ROIs or hard deliverables. They're not mutually exclusive of profit. They're not mutually exclusive of innovation. Like love, kindness, they can actually help us achieve profit. So I think in a corporation where we're used to having to explain to board members or our leadership certain initiatives that we want to take, and where we have to show the ROI of that, we can, have initiatives that are spreading kindness and love really show not only the positive impact of that, but also an actual ROI in terms of profitability, in terms of savings, in terms of the advancement of a company. So both of those things they're not mutually exclusive, and both of them can actually help each other.
Yeah, it can be an ROI amplifier, actually, as you share.
I love that word. Yes, exactly.
Any final word of wisdom, Maheen, for leaders around the world?
So I would say my professional mentor told me this: just become comfortable with being uncomfortable. Anytime if something is worth it, if something is meaningful to you, you're going to feel a little level of discomfort if you don't have it. But that just means it's something that's important to you. And so get comfortable with feeling uncomfortable, pushing yourself, pushing your organization, and not getting stuck in a plateau or in a default state of this is good enough. And just be a constant learner, and just constantly learn and grow.
Thank you. Thank you so much, Maheen, for being with me today and for this great chat.
Thank you so much, Naji.
Thank you all for listening to Spread Love in Organizations podcast. Subscribe and connect with us on SpreadLoveIO.com and your favorite podcast app. Most importantly, spread love in your organizations and spread the word around you to inspire others and amplify this movement our world so desperately needs.